Hello everybody, Dr. Shadi Ireifej here, surgeon in Los Angeles, California. I'm here to talk to you about this pandemic occurring with coronavirus. I'm going to start off by first talking about coronavirus in the veterinary field, irrelevant of the crisis that's occurring, and also let our veterinary colleagues out there know and pet owners know what the veterinary community is doing about this disease to make sure that we are still staying open to take care of sick pets. And also then I'm going to follow up with finally with what my thoughts are on the human side of things as far as what this sort of means as far as the virus transmission, what it's doing to impact people in general, and what you should consider doing as far as preventative measures. Coronavirus infection in general is actually quite common in veterinary medicine. There are documented cases of dogs and cats, and I won't speak to other species. My specialty, of course, is dogs and cats. And in dogs, we typically see coronavirus with showing gastrointestinal signs, maybe like vomiting, diarrhea, not eating, lethargy. It tends to be, relatively speaking, self-limiting. Obviously, if your dog requires rehydration or medications that are going to help with diarrhea or vomiting or what have you, then your veterinarian, of course, will make those recommendations and go from there. The tests that we have out there for both dogs and cats to confirm coronavirus are they are in existence. They're not completely reliable, so there's lots of discussion and research based on that, still ongoing regarding that. But despite that, dogs will typically get the coronavirus infection that causes gastrointestinal signs. Now in cats, they are a little bit different. There's two different pathotypes of coronavirus in cats. There's the enteric form. Enteric is a medical term for gastrointestinal. And so they'll have signs similar to dogs with gastrointestinal signs, and that's the majority of cases in cats infected with coronavirus. But there's also a second subtype, or rather pathotype, of coronavirus in cats that causes a disease known as feline infectious peritonitis, FIP. And that occurs when the enteric coronavirus mutates into the peritonitis version of coronavirus in cats. The enteric form of coronavirus in cats is similar to what I just described about in dogs. Gastrointestinal signs, self-limiting. If you need supportive care like rehydration and anti-nausea medications and what have you, then your veterinarian will of course make those recommendations. And those cats typically will overcome the infection and go on. And the tests are similar to dogs. There are tests out there. They're not that great. There's pros and cons to each test, and your veterinarian can give you more information on the specifics of that test. But that's the way typically it will go with coronavirus in cats as far as the enteric form. The peritonitis form, feline infectious peritonitis, is a different story. About 10% of coronaviruses, we believe, will transform into FIP. FIP is invariably lethal. There's no treatment for it. And there's two types of FIP. There's the wet form and the dry form. The wet form appears to be much more common in cats. And so what the wet form does is the virus causes organs in the body, especially in the abdomen, to start producing fluid, which is known as ascites. Fluid in the abdomen is called ascites. And so the clinical signs in cats, the symptoms, if I may, will be variable, will show illness and what have you, just like any other disease, but their belly will fill with fluid. And although there are many diseases that can cause that in cats, one of the considerations is going to be FIP. And if FIP is suspected based on clinical signs and history and physical exam findings, or it's confirmed based on the tests that we do have present, then invariably, unfortunately, FIP tends to be lethal, and it could be within days to maybe up to 7 days, 8 days for them before they're going to perish from that disease. Once they show clinical signs and they're diagnosed. A cat can have coronavirus and not really show much illness, but once it turns into FIP and you have a cat that's sick and you're diagnosed, typically within about a week, give or take, unfortunately the kitty cat's going to pass from FIP. So that's a very sad ordeal. And then the dry form, that's the wet form. The dry form of coronavirus that mutates into FIP causes what are called granulomas, Pyogranulomatous growths, inflammation in the body. And so basically they act like tumors, although it's not cancer, but you'll have these growths that are mixed with scar tissue and white blood cells that'll develop in any organs, typically the abdominal cavity like liver and spleen. Lungs can be affected. Neurologic signs can develop if it forms in the brain or spinal cord. And again, it's the same ordeal, it's just a different form of the disease where it's going to be lethal once it's diagnosed and once your cat's sick from it. So things that you can do to prevent it in both dogs and cats, it's fairly similar, I guess, to people. It's really just hygiene, but If dogs or cats are going to get it, they're going to get it, and you may or may not even know about it until they're ill. And most of them, if they're ill, are going to have the enteric form, in which case you'll make it through. If it transforms in cats to FIP, then of course there's unfortunately this time no hope there. Dogs don't have the same mutation where it goes from a benign form to a more malignant form. It just seems to be the enteric version of the coronavirus, and that's that. We used to vaccinate dogs for coronavirus. It doesn't seem to be the case anymore. I don't know if that'll restart. In cats, we don't have a coronavirus vaccine. It is right as of right now, we believe it is not possible for you to get coronavirus as a human being from your dog or cat, even if they have the disease. It may be more likely that if you yourself have coronavirus and the coronavirus decides to jump species, that you could infect your dog or cat, especially if your dog or cat is already debilitated with some other disease. If they have cancer, or if they have a weak immune system, if they have diabetes or cardiovascular disease. The list goes on and on. Just like in people, if you're sick, then your immune system is not as good. And if your immune system is not as good, you're more likely to get diseases that your body could otherwise normally fight off. And so if you out there are concerned about contracting coronavirus yourself, you're not going to get it from your dog or cat. And it's more likely that if you have it, that you may give it to your dog or cat. And so the disease progresses from there. So there's the big risk factor, especially in cats, is having a young cat. They're more likely to be affected by this. And also, if you have cats live in a multi-cat household or a cattery, and cats in close proximity together, the coronavirus will, of course, do what it's been doing, jump from individual to individual. It could cause the enteric form, and then eventually, if it mutates to the peritonitis form, then feline infectious peritonitis is what you're going to be dealing with. And so we do see a higher incidence of this in younger cats and cats that also are living with lots of other cats. Also, if you have a cat that's indoor-outdoor or purely outdoor, then they are going to be, in theory, interacting with other cats out there, and virus transmission, of course, is a higher risk. But that's the case with a lot of these viruses anyway. If you have a cat that's interacting with other cats, they're more likely to transmit viruses to each other. So, and viruses, of course, can travel for a great distance outside just by being carried in the wind, and dogs and cats can be affected by them. But those are some preventive measures you can do. Try to keep your cat indoors. You try to minimize the number of cats in your house, or if you're going to adopt a cat, try to have them screened. Although that's easier said than done. And if you yourself have contracted coronavirus, try to keep yourself isolated from your dog or cat, especially if they are themselves ill. Then they're more likely to get the virus. And so on the human side of things, you can imagine, of course, just like everybody else, from a business standpoint, we're being greatly affected by this. And the American Veterinary Medical Association, AVMA, has just released an email to the veterinarians instructing us as far as what they're trying to do to fight this the financial impact this disease is having on the veterinary field. Because we still want to stay open. We want to be classified as an essential business, meaning that we won't shut down even though this crisis is occurring. We want to maintain open doors because animals are going to need our help, our medical expertise. And so as of right now, the AVMA is working not only with the CDC and the FDA, but with multiple federal government agencies to try and make it so that they classify us as an essential business, and that way we can stay open, and our doors can stay open, and we can still take care of sick dogs and cats, and that's the goal here. There is a bill that they're trying to pass to try and make these things official, but not only that, not only try to maintain our doors, our open doors, but also try and take care of our employees. So a lot of veterinary hospitals across the United States are asking their employees that if they're showing any signs of respiratory illness, that they stay home and they don't come back to work. Or if they've been traveling recently on an airplane, they were asking them to stay home. And we're trying to get coverage, or try to get approval rather, from the U.S. House of Representatives to be able to take care of our employees by still paying them, even though during this crisis, even though they're not going to be coming to work. And so we're trying to make those things more official. Obviously, this is still unfolding and it's impacting everybody financially. There's no easy way about it. And so finally, what do I think as far as a doctor, how people are reacting to this and what should be considered? And in my eyes, viruses this is what they do, right? They are always at risk of mutating, and if they mutate sufficiently enough, then they can jump from one species to another species, and that's always a risk with viruses anyway. And viruses have to balance killing the host, which is you, the infected individual. They have to balance maintaining the health of the host and not killing them, or at least keeping the host alive long enough to spread. And so the coronavirus is especially frustrating because although people have died from coronavirus, lots of other people are actually just going to be infected by it and show mild to severe respiratory signs, but still live through it. And during that process, the virus can continue its spread. And that's what the virus wants to do: maintain the host alive long enough so that it can facilitate its spread. With any introduction of a new organism to a species who's never seen this before, there's going to be this insane uprising casualties. There's going to be a large morbidity and mortality to any species that's experiencing an infection for the very first time. That's typical. That's typical. Any disease that any species interacts with for the very first time are going to be hit hard by it. Until the population it develops enough immunity to it, enough antibody protection to make the disease either be able to abolish it or at least keep it to a very low fundamental level, which is why you're seeing everybody compare coronavirus to like your standard flu, even though the viruses may be the same, or a different variation or different family of viruses or whatever. We don't see such devastating or such rapidly devastating effects by the flu necessarily because it's been with us for a very long time, and so the majority of us have herd immunity. The population has seen the flu. Their immune system has experienced the flu, built antibodies towards it, and collectively, as a whole, we tend to protect each other because we've all been exposed to it and have the antibodies to fight it. That being said, as you've heard from the news, of course, people still die from the flu. Yes, they will. It's just not going to be as such a rapid rate as with the coronavirus. And also, the ones who are going to be hurt by it the most are going to be those that are debilitated. They're immunosuppressed, so they have a weak immune system because they're on special medications. They have cancer, they have HIV, they're geriatrics, they're older people, and cardiovascular disease, obesity. We know these conditions predispose to a weak immune system. If you have a weak immune system, you're going to be more likely to contract the virus, any virus, and have the worst effects of it. Whereas somebody who's healthier or younger or what have you is going to be able to either avoid the virus, not contract it, or if they do contract it, not show any signs, or if they do show signs, they're very mild signs, and even in cases that they show more significant signs, they're more likely to recover from it. So I think that what we're seeing here is pretty typical. It's sad, of course, and disastrous on many levels, but it is something that is sort of what happens. And as we get exposed to it, develop antibodies towards it, we're going to have casualties, of course, on the way, but eventually we'll break through this and have herd immunity where the population overall considers this just like any other flu. It's frustrating for most people. Most people don't get it. When they do get it, it's just annoying. And there's a small percentage of the population who already have pre-existing conditions that are going to contract it and unfortunately have really severe consequences to it. The hygiene aspect of this, the washing the hands, is very important for this, but of course it's important with any disease. I mean, if you live anywhere that's ever had the flu, especially when we see it in the United States, we know every winter, right, there's an outbreak of flu. It's important to maintain hygiene anyway, regardless of this crisis. I think face masks are a little bit overkill. They are great for surgery, when we perform surgery on dogs and cats, but as far as minimizing transmission, this is a viral infection. It's a respiratory viral infection. It's passed on by breathing. And there are certain masks that are very, very good at preventing particles from emitted through your nose and mouth, but the masks that people have out there are not going to do the job. And I suppose it doesn't hurt to have it, but I'm not sure that's really the way to go. It seems more likely that if you avoid large crowds, populated areas, that's probably more likely to minimize your risk because it is passed on just by breathing, and so we're not going to stop breathing, so you have to just minimize your exposure to other people, large crowds. And certainly all the other myths that are online just debunk those. It's all just crap. Just go to the FDA website, go to the CDC website. In fact, the AVMA website, they have sources of information as well that you can go to actually get real information. World Health Organization, WHO. These are places that you want to go to get your information. Don't go to Facebook, don't go to other social media avenues to look at what people are talking about. Go right to the source of the information, get it from the facts, from the scientists, the doctors that are experts in infectious disease. And so that's my take on it. So I hope this video helps recap how it works in the veterinary field, how it's impacting us, what we're trying to do about it in the veterinary field, and also what my thoughts are from a community perspective as far as how crazed you should be about this. I think that it's going to be months for us to get through this. It's not going to be a quick fix. It's not going to go away that quickly. And it doesn't seem that vaccination is coming up anytime soon. It just seems that the hysteria needs to be controlled. And I think that if we follow the links at the AVMA website, CDC, FDA, WHO, get your facts from those resources there, so you know what to do. But I'm not so sure that the hysteria really is warranted at this time. So I hope this video has helped you so much. Leave any comments or questions below. Thank you so much. This is Dr. Shadi Ireifej, and we'll see you in the next video. Hi there, Dr. Shadi Ireifej here, veterinary surgeon, Los Angeles, California. I wanted to make a follow-up video to the coronavirus video I made on YouTube and Instagram. There was a similar scenario here that we're experiencing where people are kind of living in fear. And it reminds me, unfortunately, of 9/11, where we had a sort of a massive overhaul of individuals that didn't want to go anywhere. They didn't want to go to movie theaters or malls or fly anymore because of the fear that there may be another terrorist attack, because 9/11, of course, was so awful. And the big message that everybody was talking about, at least from the news and each other, was like, well, do you want to live your life that way? You know, if there are always going to be bad people out there plotting bad things, and so if you're going to run away from it and stay inside, well, what good does that do for anybody out there? It's bad for us as people. We should stand up for our rights and our freedom, and it's bad for the economy, of course, because you're not out there doing stuff, enjoying restaurants and bars and movies and shopping, and it means that the bad guys win, because if you're staying indoors, not living your life, then it's part of what they want you to do. And so the whole concept of if you see something, say something, of course, is very important. That helped us in terms of, like, if you see something weird, something suspicious, you should report it. And that's the way to go about it. Go live your life, but if you see something weird, then you should tell somebody, tell an authority on it. And so the coronavirus outbreak and the crisis associated with it reminds me of it. You want to live your life. Yes, if you're debilitated, if you're older, then you need to be more cautious about it. Maybe you shouldn't go out and do what you would have done prior, because you are more prone to having a problem. Maybe if you're somebody of an older age, you should try and stay inside. But those individuals also are always at a higher risk of these diseases, regardless of this. And the difference here between viral infections causing a pandemic and terrorism, for example, is that you can't see the virus, right? You can't use, if you see something, say something. It's impossible, right? It's a virus, microscopic. You're not going to see it. And if you have somebody out there who's coughing or sneezing or whatever, well, they could have any other disease. It's not just going to be automatically a coronavirus infection. So I think to a certain degree, although we should take precautions for people who are at risk, older people with other conditions, other diseases, I think it's also important that if you're in a low-risk population, somebody who's younger, healthier, what have you, I think that you should be able to go live your life. Go out, go to the movies, go to restaurants, go eat, what have you. Maintain hygiene, like I mentioned in my previous video, but live your life. I think this is just the hysteria that's happening out there. This video won't stop it, and this is gonna be an outbreak for months. Things like this don't go away quickly, but if it offers people out there any sort of incentive to do other things, for one, I'm still going to travel. I'm still going to go out, as long as places remain open, which they are slowly being closed down. But as long as they remain open, I'm still going to go to the gym. I'm still going to go shopping. I'm still going to go to bars. I'm still going to travel. I'm still going to do my thing. I can't live I'm not going to live a life in fear. I, of course, am fortunate enough, though, too, that I'm not around people who are ill, who I'm going to potentially infect. I'm not around older people who I could potentially infect. I myself am healthy, and so I'm a low-risk population. So easy for me to say it. Individuals who live in who work in the medical community, who are dealing with sick people every day, it's a little more dicey there. If you're working like in a nursing home or a geriatric home, it's a little dicey there. You don't want to, you want to live your life, but you also have to be conscientious of the fact that you're around people who are going to be more prone to developing an illness that you may have transmitted to them. And that, of course, is horrible. So weigh the pros and cons depending on you as an individual, what you do as far as work goes, what the possible interactions you have with other people who are at risk, and then make a decision and go from there. I, for one, in my situation here, am a low risk individual, and I don't hang around people who are immunocompromised or geriatrics. Not out of choice. They're just not in my life. But just keep that in mind, and hopefully that at least gets a conversation going about living in fear versus being subject to the disease that's occurring currently. So thank you so much. Dr. Shadi Ireifej. Leave any questions or comments below. Take care.